Hello guys, today let's discuss about the differential diagnosis of vaginal discharge. Now this is one of the most common condition which you will come across when you sit at a gynec OPD. So it's very important for us to know about each type of infection and how they will present. This has been time and again tested in various formats in NEET PG, INI, CG, and of course as a resident you have to know this. So this table I have taken from the Datta textbook of gynecology, which they have beautifully summed up all the kinds of infections in vagina. So first let's try to understand that when a woman comes to you with complaint of white discharge, that's how they usually tell that there is some discharge. They usually tell something white, but you're supposed to ask about the color, its consistency, if it's associated with any foul smell, any associated symptom of itching. Also very importantly, you need to ask her about any symptoms of UTI like burning maturation or increased frequency of urination or any pain during maturation. Okay. Also you should ask about any associated complaints of lower abdominal pain, because we want to know whether it is associated with PID and UTI. So these are the important questions that you have to ask when a patient comes to you with discharge per vagina. So the important differential diagnoses are trichomoniasis, candidiasis, bacterial vaginosis, chlamydia. Okay. So first let's try to understand how is a normal vaginal discharge look like. So it will be white in color, be thin in consistency, and the whiff test will be negative. I'll explain to you what is whiff test in some time. Remember that the pH of normal vagina is acidic. I'll make another video regarding the flora of a normal vagina. So stay tuned to the channel. But for now you need to remember that the vaginal pH is acidic in a normal female in a reproductive age group. Now when it comes to trichomoniasis, the very characteristic color of discharge will be greenish yellow. Okay, it will be greenish yellow. It will be thin and frothy. Okay, whiff test will be negative. Now let's try to understand what is whiff test. Whiff test means there will be fishy amine odor when a drop of discharge is mixed with 10% potassium hydroxide solution. So the most important thing you need to remember is 10% KOH. When you add a drop of it over the vaginal discharge that you have taken, there will be a fishy amine odor, and that is called as positive whiff test. So that is negative in trichomoniasis, right? pH will be more than equal to 5. That means it will go towards the alkaline side. It will be associated with pruritus. That's a very important point to remember, and that's precisely why I asked you to take a thorough history and ask regarding any associated complaints of itching. So that is associated with pruritus. When you do a wet mount microscopy, you see the motile trichomonas. Okay. Treatment of course is metronidazole, where you will give 2 grams single dose or 200 milligram TID for 7 days. That means thrice daily you will give for 7 days. So this is the management for trichomoniasis. Now let's try to understand about candidiasis. C for candidiasis, C for curdy white. Okay, so it's a fungal infection and it will look curdy white. The consistency will be thick curdy like discharge, and it's very characteristic. The moment you put a sperm speculum and see thick discharge, you will definitely know it's candidiasis, and maybe once when you see, you will never forget. And the consistency I told you already, it's thick. This also will test will show negative. And pH here will be less than 4.5. Important to remember. This also is associated with itching. So candidiasis, trichomoniasis, both are associated with itching. When you do a wet mount microscopy, you will see hyphae or spores because it's a fungal infection. Treatment is imidazole or fluconazole you have to give. Antifungals are the drug of choice. How do you give fluconazole? You will give 150 milligram per orally weekly for 6 weeks. So once a week she has to take the tablet for 6 weeks. Okay, this is important to understand. Next, very importantly, is the bacterial vaginosis, which is the most important, very most common also, and this is also associated during pregnancy with vaginitis. So this is something which you absolutely cannot afford to miss. So here you will see that the color will be grey-white, which is very characteristic, thin in consistency. This shows positive with test, very important to remember. It has a pH of more than equal to 5, so this also has a higher pH. It does not cause any itching, and clue cells are seen. This is important. Now what are clue cells? So what you do is you take a smear, you prepare a smear of the vaginal discharge, and then you observe it, and you add a few drops of normal saline on a glass slide, and you just observe it under the microscope. You will see that the vaginal epithelial cells are studded with a huge amount of bacteria. Okay, these are nothing but the cocobacilli, and they are so heavily stippled sometimes that even the cell borders of the vaginal epithelial cells are obscured. Now this is known as clue cells, that is, the stippled epithelial cells are known as clue cells, and this clue cells, more than 20% seen under microscope, is positive. Okay, and it is seen in bacterial vaginosis. Very, very characteristic, that is clue cells and positive whiff test. So treatment of bacterial vaginosis, I'm sure you all know, is metronidazole 200 milligram. TDS for 7 days you have to give. Drug of choice remains metronidazole even in case of pregnancy with bacterial vaginosis. Next comes chlamydia. Chlamydia will have mucopurulent discharge. It is thick in consistency. It will have negative whiff test. Again acidic. This shows acidic pH. Chlamydia is diagnosed with the NAT test. Okay. And the drug of choice is azithromycin. So this is very special, so you have to remember azithromycin 1 gram orally, single dose. The chlamydia comes under your sexually transmitted infections, so you have to remember this. So this is in a nutshell about all the important differential diagnosis of vaginal discharge. Each and every point of this table is a potential MCQ. And also stay tuned, because I'll make another video about the normal vaginal flora and how it differs in different age groups. Feel free to write in the comment section if you have any doubt. Also, I have already made a video regarding the syndromic management of the STIs, so you can check the channel and the link below in the description. Take care and bye-bye.